Yeah, you did.
That's probably Hello, Natasha. Hi, my name's Chelsea. I'm going to be your nurse today. We're going to do a couple assessments, okay?
Okay.
First, I'd like to say that we're going to go over your cardiac system, just to talk about things. I want to go over your health history. Recently, have you had any chest pain?
No.
How about shortness of breath?
No.
With activity?
No.
How about any shortness of breath when you're lying down?
No.
No? Have you recently had a cough?
No.
Do you feel fatigued in any way?
No.
Okay. Have you noticed that your fingernails have been blue or blue around your lips, anything
No.
like that?
Nope. Nothing.
Swelling of your legs?
Nope.
Okay. Have you been urinating more at night?
No.
Okay. Let's talk about your family history. Do you have a family history of cardiac problems?
Yes.
Okay. And have you personally ever had any cardiac problems?
No.
And what was your family history?
My father.
He had a heart attack?
Yeah.
Is he-
Quadruple bypass. Before.
Okay. And he's still alive?
Yes.
Okay. Good. Do you have any bad habits, risk factors like smoking, bad diet, anything like that?
No.
No? Okay. Well, then we're going to go to the assessment part of it. Okay, so first let me just check your pulse. .78, beautiful. And now I'm going to check your blood pressure. (136/70). Very good. Everything seems to be normal there. Next, I'm just going to take a look at your extremities. Make sure you have no swelling at all. Nope. No edema noted there. No. Okay. Good pulse points. Good. Okay. So now I have to palpate your carotid artery. Okay. So I'm going to do only one side at a time because if I do both, then we could decrease blood flow to your brain, and we don't want that to happen. Oh, good. It's a strong, moderate pulse. Good. Very good. Strong on this side, too. Both are bilateral. Next, I'm going to just listen right there to make sure that there's no bruit or anything going on, okay, any abnormal sounds. Nope, everything sounds perfect. Okay, so now I'm going to just have you lie down a little bit. Yeah, that's fine, just like that. I can't have you more than a 30-degree angle. And just put your neck back. Oh, good. I see a small amount of jugular vein distension, but it's less than 2 millimeters, so we're good. Okay, you can sit back up. Okay, and so now I'm going to listen to your chest, where I'm going to listen to your apical heart, okay? Okay, very good. Now I'm just going to feel around and make sure that you have a pulse point there that I can feel. Some people have it, some people don't. If you're skinnier or women, we have breasts that occlude that area. So, but I'm still going to feel to see if I feel any other abnormalities. Nope, no abnormalities. Great. Okay, now I'm going to listen for each valve. Okay, you have 4 different valves in your heart, so I'm going to listen for each valve. Make sure that there's nothing abnormal there. Okay. So this one I'm listening to is the aortic. And this one is the pulmonic. And then this one is the tricuspid. And then midclavicular is the mitral. Okay, good. And I don't hear any abnormalities there. Okay. Okay, so so let's talk about some risk factors that could be associated with the cardiac cycle here. Has anyone in your family had hypertension or high blood pressure?
Yes.
Okay, so basically they consider hypertension now 140/90 as systolic pressure, the top number. Anything greater or equal to 140 is considered hypertensive. And the bottom number, anything greater or equal to 90 is considered hypertensive. Basically, it's 2 to 3 more times common in women your age if you take oral contraceptives. Are you taking any?
No.
Okay, then we're good there. Do you smoke?
No.
Okay, good. Smoking, nicotine increases the risk for an MI or stroke. Do you have obesity in your family?
Yeah.
Okay, and do you have type 2 diabetes?
No.
Okay. Type 2 diabetes can cause damaged vessels, and they damage the vessels in the body that nourish the body of good oxygenated blood. Also, high cholesterol. Have you ever had that checked?
No, mine's fine.
Okay.
All my risk factors are from my father.
Okay. Well, high cholesterol also increases MIs and strokes for patients. Okay. So basically, that's it for the cardiac cycle. Do you have any questions for me?
No.
Okay. Next, we're going to go on to your neurological cycle, which is much more complicated. And I'll be right back, so I'm just going to get all my stuff.
Sure.
Okay, first, I'm just going to ask you a couple health history questions pertaining, just like last time, to the neurological system. Have you had any recent headaches?
No.
How about a head injury in the past?
No.
Any dizziness, vertigo, feeling like the room is spinning?
No.
Any seizures or tremors noted?
No.
Any weaknesses, like
No.
especially on one side? Do you feel like you're unbalanced or you have lack of coordination?
No.
Okay. Any numbness or tingling in the lower extremities, the upper arms?
No.
No? Any difficulty swallowing or speaking?
No.
Okay. Does anyone have a past history of strokes in your family?
No.
Okay. And are you exposed to any occupational hazards, like lead, anything like
No.
that in your
No.
work field? Okay. No? Alrighty, then we'll begin with the assessment, okay? So first I'm going to do the cranial nerves. Alright. Have you had any loss of smell recently
No.
with anything? Okay, because if you did, we would assess this cranial nerve, which is the first one, by having you smell different kinds of scents. But because you haven't had any loss of smells, we're not going to go there. How about, have you been to the eye doctor recently?
Yes.
Okay, and did he make you do an eye test where you have to cover one eye and then, yes?
Correct.
Okay, and was anything abnormal there?
No.
Okay, good.
Just wear contacts and glasses.
Okay, good. Okay, and your vision is improved with the contacts and glasses?
Correct.
Awesome. Okay, the next one we're going to look at, this one is, it's called the oculomotor cranial nerve, and it has effects on both sensory and motor functions, meaning that it does two things that we don't know about. One is it controls the lateral movements of the eye, or the extraocular movements of the eye, and it also constricts the pupil portion of the eye and develops the lens shape. So I'm just going to have you keep your head still, okay? And I'm going to have you follow my finger.
Okay.
Okay. And now I'm going to take this and I'm going to point it into your eye and see if your pupil constricts. Very good, very good. Both constrict equally. Okay, next, basically, the next one is, now, the cranial nerves 3, 4, and 6 are all dealing with the eye. Okay, so basically there's nothing abnormal that I have seen in either eye. Basically, both your eyes move bilaterally and equally. You don't have nystagmus where they're going back and forth, backwards. Your pupils constrict and everything looks okay there. Okay, so next I'm going to look at the trigeminal nerve, okay, which is also, it has both. It has mixed purposes. It has sensory and motor. Basically what this does is it helps the muscles in mastication, chewing, and it also gives the sensation of the scalp, cornea, mucous membranes, and mouth and nose. So the senses that you feel in there, the moist, and also chewing. So basically I'm just going to have you put your jaw, clench your jaw down. Okay, it's equal bilaterally, good. Okay. And then I'm just going to take this little cotton swab and I'm going to bring it down your face and you're going to tell me when you feel it. Just say yes every time you feel it.
Yes. Yes. Yes.
Okay.
Yes. Yes. Yes.
Good. Okay, so everything looks okay with that nerve. The next nerve that we're going to do is the facial nerve. Okay, basically that also has mixed functions. The sensory aspect of that is that it tastes, it has taste buds. It's your taste buds in the anterior two-thirds of your tongue. Have you had any taste problems recently? Not being able to taste anything salty, sweet, anything like that? No. Okay. Basically, then I'm going to make you puff your cheeks out and go. Okay, and I'm gonna go like this, and you're gonna blow it out. Okay. Okay, good. They're equal and bilateral. And then I want you to smile for me. Very good. Awesome. Nothing looks abnormal with your facial nerve. Next one is the acoustic nerve, which, have you had any hearing loss or anything like that? Have you ever had your hearing checked?
Yes. Everything was normal with that.
Okay. Some people, when they do, we have to do the whisper test, which if you haven't had any abnormalities, we're not going to assess that. Next is the glossopharyngeal one, which this aspect works on swallowing, and you said you had no trouble swallowing, okay? But this has a sensory aspect also on taste of the posterior one-third of the tongue and also the gag reflex. So I'm just going to do a test on a gag reflex. Okay? I'm going to take my tongue depressor. My cotton zip. Very good. You gagged, yay. That's a positive reflex there. Okay, the next one is the vagus nerve that we're going to look at. This also has mixed motor functions, like talking and swallowing. Now, because you said you had no difficulty with speech and nothing with swallowing, you don't really need to investigate further in that. The spinal accessory nerve, this one is the movement of the trapezius and the sternocleidomastoid muscles. So basically what I'm going to have you do there is I'm just going to make you turn to me really quick. Everything is equal and bilateral in size. Good. And I'm going to make you okay, I'm going to push my hand and you're going to go against the resistance. Good. Now I'm going to push it this way. Go that way. Yep, very good, very good. Okay, and everything's equal in strength and bilateral on that side. The last one is the movement of the tongue, the hypoglossal. Can you move your tongue for me just around? Very good. So it looks everything like neurologically, cranial, nerve-wise, you are intact. Next, I need to assess your mental status. So can you tell me your name?
Natasha Chikini.
Okay, and can you tell me your age?
31.
Okay, and do you know what year it is?
2014.
Good, and how about who's the president?
President Obama.
And which facility are we in right now?
The Schuylkill South.
Okay, good. Okay, so next we're going to check for motor systems, which is muscles. Basically, for that, we're going to have to check for the aspect of the muscles. We are going to do, I'm going to look at each muscle, which they're both look equal in size. I don't see any abnormalities where one is bigger, where you would have atrophy or wasting of another. Next, I'm going to have you, we're going to check your cerebellum, so I'm going to have you stand off and stand in front of me. Okay? That's okay, you're going to stand up. I'm going to focus it more on your legs.
Okay.
And I'm going to have you just walk heel to toe for me. There. Good. Okay, good. And then next, I'm going to have you stand on one leg. Okay, and see if you can hop. Good, and then do it on the other one. Good. Okay. Very good. Okay, you could have a seat. Okay, so that test that we just did was the Romberg test, the hopping one. Okay, and next I just want to check out some tone, which basically I'm applying a little bit resistance there, and yep, and your bicep is nice and firm in tone. Okay, good. Okay, so now I want you to check your coordination. I want you to pat your knees like this, and then I want you to flip your hands interiorly and pat them like this. Very good. Do you have any issues there? Do you feel any? Okay. Next, I want you to put, Okay, next I want you to take your pinky and or your thumb and touch each finger, and then go back and forth as rapidly as you can. Very good. This is testing your fine motor skills. Okay. Now I'm going to make you point your finger on your nose, and then I want you to put your finger to my finger. Okay, now put it back to your nose, and then put your finger to my finger, put it back to your nose, put your finger to my finger. One more time. Okay.
I get it.
Good, try to get it in there. Okay. Very good, very good. Okay. And basically next I just want you to take your heel and see if you can put it up to your shin. Okay, there's your heel, and rub it up your shin like that. Yep, just like that, and then do it on the other side. Very good, very good. Alrighty. Okay, and then so the last part of this is we're gonna do some sensory ones, okay? Which basically those just deal with just testing your skin to see how sensitive you are to certain material I put on it, okay? So first I'm just gonna take this and I'm gonna prick you. You're gonna tell me if you feel, you know, a little pain sensation.
Yes.
Okay, good. Now I'm gonna take something very smooth and rub it on you and tell me if you feel this.
Yes.
Okay, good. Then next I'm gonna take a cotton swab and I'm just gonna lightly brisk it to see how how easily your skin is triggered.
Yeah.
Yeah? Okay, good. Tap it on this side.
Yes.
Okay, good. Okay. And then I'm going to take this and it's going to vibrate, okay? And I'm going to have it vibrate against your skin, and you're going to tell me when you feel the vibration and then when you feel it stop.
Okay.
Okay? All right, so.
Yes.
Okay, and.
Yes.
Okay, very good, very good. Okay, now the next one is I'm just going to have you put your fingers out like this and close your eyes. And you're going to tell me when you feel the slightest bit of your skin move forward.
Yes.
Okay?
Yes.
Good?
Yes.
Good?
Yes.
Good?
Yes. 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 Yes.
Very good, very good. Okay? Okay, so now I'm going to give you an object, and I want you to close your eyes, and I want you to tell me what the object is. This is basically using some tactile, fine touch, okay?
A pen?
Yes, good. Okay. Next, I'm going to take the pen and I'm going to draw a number. Okay. On the inside of your palm, and I want you to tell me which number it is.
6.
Yes. Very good. Very good. Okay. And so basically everything has been okay there, except the last thing I'm going to do is it's a 2-point test where I'm going to poke you at 2 points, and you're going to tell me when you can't feel that it's 2 anymore.
Okay.
Okay?
Mm-hmm. No. Yes.
Okay. All right, very good. They basically had to be on top of each other for you to feel that they weren't 2 different points. So the last part of this is we're going to do just some deep tendon reflexes, which I'm sure everyone is familiar with. I'm just going to have you, we're going to do this one. Oh, good. Very good. It's not hyper-reflexive or anything like that. Okay? And then next we're going to do your bicep one, okay? Which, hold right here. Wow, very good. And the tricep one. Good. Alrighty, and so after we do that, then I'm just going to have you grab both of my hands, equal grasps, as tight as you can. Very good. And then I want you to close your eyes and put your arms out. Good, no drop, okay. And then I'm going to have you push against my hands. Good, and push up. Good. Okay, and the last one is we're just going to do the plantar one where I rub this and you'll see that. Yep. Okay.
Yes.
Yes. Good. Okay. And lastly, we'll just go over some risk factors for you, okay? Basically, a risk factor is hypertension, which we went over previously.
Mm-hmm.
You said that you had some hypertension in your family, so that could give you a risk factor for having strokes or anything neurological, okay? Smoking. Same thing, basically increases the risk for those. Alcohol and drug use can increase any type of neurological factor that we have along with high cholesterol.
Okay.
Okay? Do you need anything else?
No, thank you very much.
Okay, have a great day.
You too, thank you.